Welcome to our 5 on 5. Pleased to bring back Freddy Sennhauser, the VP of Marketing and Communications for AllCare Health. Freddy, good to see you again.
Yeah,
how are
you, Craig?
Thanks for coming. So, how large of a service area, first off, does AllCare have?
We serve Jackson, Josephine, and Curry County, and then just the southern portion of Douglas County, Glendale and Azalea.
Okay, and who do you serve in these areas?
Surprisingly, we serve 1 out of every 6 people that live in this service area. So today, about 54,000 members overall.
Okay, and that's OHP?
That's OHP,
okay.
And that's also Medicare Advantage.
Okay, all right. And so you are a physician-led organization. What does that mean to our viewers at home?
Well, it means that the control of the health plan is done here locally. And we feel by being right here with the control that we can respond to issues much quicker. We have the ear of the population. And we have also, community advisory committees that help us direct our plans, our benefits. So we're just really a local plan, local controlled, and right here for the people in the Rogue Valley, Josephine County, Jackson County, and Curry County.
Okay, and so we thought the interview would be a good idea right now because there's a lot of insurance changes coming up. It's always something we do every fall. We even did this interview a year ago. What changes should people expect through OHP or through Medicare this coming year?
Well, our Senator Wyden has been very instrumental years ago to push through some innovative changes. And we have done this in the past, and we are introducing a new one next year, this additional telehealth services. So where folks, if they, for whatever reason, cannot leave their home, they have now an ability to talk to a provider, one of our providers. And we have more than 1,600 available here in our service area, and talk with a provider who then has the ability also to bill that member and so take the time. It's almost the same as an office visit, but now for the member's perspective from the comfort of their home. That's brand new, and that will make us just a bit more efficient. Yeah,
that makes sense. It is, I would think, much of a huge cost savings for both the organization, AllCare in this case, and the people, because there are only so many experts in our area, certainly in Southern Oregon and in rural Oregon. A lot of the experts are up in Portland. It's hard to get in to see them. Is there any kind of estimate on wait times or anything like that, or are we still working that stuff out?
No, I don't think there's going to be any issue there. It really depends on each provider's office, what their abilities are, but many of those provider offices today, they have abilities to kind of just push those appointments in between. And that's really kind of like almost like on a real-time service. So a member calls up, and if the physician has a moment for that, then they can just get those folks in. So the proof will be in the pudding. How is it going to work? I'm sure we'll make some changes. We'll have to adjust to the reality, but at least it's a good step. Before we could never do this, so now we're taking baby steps and see how we can improve the lives of our members down here.
Yeah, technology is amazing.
That's right.
Wonderful advantages. We're going to take a quick commercial break. Stay with us. We'll be right back. Welcome back to our 5 on 5. Going to hear with Freddy Sennhauser from AllCare Health. So we're talking about all the insurance changes people can expect in 2020. First off, crazy that 2020 is finally coming. Medicare changes. Should people expect anything this coming year?
Yeah, there's actually a rather big change from my perspective, surprising actually. In 2003, when the Medicare Modernization Act was passed into law, it talked about how the donut hole would be closed in the year 2020, and here it is, 15 years later, give or take. And so it's a big change for our Medicare beneficiaries because now they have coverage all the way through, and it's kind of complicated, but all through the benefit stages. And now the Part D, the prescription drug benefit, is now complete, and I think that's pretty good. It's a milestone.
Yeah, that's impressive. Okay, so what benefits, just so we're clear, could a Medicare recipient get through AllCare?
Well, in particular about Part D is we offer a formulary that offers hundreds and hundreds of drugs at no cost, including all vaccines. And that just kind of shows you and our members the philosophy behind our company. We feel that if we can be as preventive as possible, providing vaccines at no cost, that's what we want to do. And so now we have the ability to do that. And like I said, we're hundreds of drugs and vaccines that we offer at no cost.
Wow. Okay. And I always love asking people who deal in insurance this question. Because it's so complicated, frankly. What do you recommend people how they can best understand what's going on with their individual insurance plans?
And I agree with you. It is complicated and it gets more complex as time progresses. But folks that need some counseling or need some help, they can certainly call SHIBA. That's a nonprofit agency funded by Medicare, but also call their insurance agent. Insurance agents are usually independent, and they are, of course, very knowledgeable about the product and certainly can guide folks through this maze.
Okay, good to see you as always. Thanks very much.
Thanks for having me.
All right, stay with us. We'll be right back.